I wanted to come on this week and do a video on Wednesday of this week. GMA had a segment on exercise and dementia. And so I figured that as a result of that, it was time for me to do a deep dive and an investigation into this syndrome or complex or the conversation associated with exercise and how exercise affects dementia. And I wanted to come on here and do a video of what truly is dementia and what is not dementia. So, dementia is a general term for a set of symptoms that affect memory, thinking, and reasoning, and the ability to perform daily activities. It is caused by damage to brain cells, right? Which interferes with their communication and normal function. And as I was doing my investigation into the literature, into the research, there were a couple of things that I found and I wanted to share with this here group. So one of the things that the most common type of dementia is actually Alzheimer's disease. And this is the leading cause of dementia, and it's accounting for 60 to 80% of the cases of dementia. So that's affecting the thinking, the memory, the reasoning, and ability to perform daily function. That's what dementia is. But there were three other types of dementia that I did not know, and I found to be fascinating. Vascular dementia, and often caused by stroke or red blood flow to the brain, reduced blood flow to the brain. Lewy Body Dementia is associated with abnormal protein deposits in brain cells. And then there's frontotemporal dementia, which affects personality, behavior, and language. So those are the four types of dementia: the Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. But here's the key kicker: that these conditions share symptoms such as memory loss, difficulty with problem solving, and confusion, but each may have distinct features based on the brain areas that are affected by these various types of dementia. What isn't dementia? So here's a key fact: that not all memory loss, cognitive declines are dementia. There are conditions that mimic dementia symptoms but are reversible, like delirium. Delirium is just known as a sudden severe confusion, often caused by infection, medication side effects, or dehydration. Depression can be confused for dementia, but it's commonly called it's connected to cognitive impairments from severe depression, sometimes called pseudo-dementia, can be depression. Vitamin deficiencies. Having deficiencies in lack of B12 or thiamine can lead to reversible cognitive symptoms, but that's not dementia. Thyroid disorders. Having an overactive thyroid or underactive thyroid conditions can impair brain function. And then normal aging, right? So just because you are old, aging does not mean that you have dementia. While aging affects memory, occasional forgetfulness, like misplacing your keys, is not dementia. Dementia involves a significant and consistent decline in abilities. And what is important is that recognizing what is and isn't dementia is critical for diagnosing and treatment. I encourage you to consult with your physician to get a full diagnosis of where you are as it relates to dementia. I wanted to come in, and then I also want to talk about this here key thing. What are some things that I can do to decrease the risk of developing and even incurring dementia? Play some brain games. Get you some brain games. I actually play Cryptogram on my phone. Reading is another good way to decrease the propensity of developing dementia. Getting out and being physically active is always a great way to decrease and attenuate and even alleviate the symptoms associated with dementia. That is the story in a nutshell. I hope you enjoyed this week's news you can use. Till next time, be blessed.